So we've talked about a lot of benefits, but let's also be realistic. With every drug, there's pluses and minuses, but let's talk about some of those now. So like we talked about, it can prevent the body from breaking down serotonin. So we have to be very careful if we use this in patients who have who are on what are called SSRIs. That's like your sertraline, fluoxetine, Prozac, those type things. SSNRIs, things like venlafaxine. So we have to be super careful when we take those drugs, because we can potentiate something called serotonin syndrome. We also have to be careful with an interaction with a drug called dapsone. Actually, that's used some in Lyme's disease. It can affect the levels. We also have to be careful with dosing in terms of severe renal insufficiency and hepatic insufficiency. Granted, we're talking very low doses. The risks are minimal, but we have to be conscientious of that. It can be harmful to neonatals. It's actually a teratogen to pregnant ladies or females. So that's important to keep in mind. We wouldn't give it to if I'm pregnant. You can have a true allergic reaction to methylene blue. But once again, most of the side effects we see are dose dependent and don't occur at higher doses. So let's talk about some other precautions. Remember how we talked about how methylene blue can ramp back up mitochondria, but it also has some antiviral, antifungal properties. It can create what's called a Herxheimer reaction. And that's a reaction where the body kind of goes into an immune, like, oh my gosh, what are you doing to me? It creates almost like a flu-like symptoms. And this can happen with methylene blue. That's why we need to kind of start out with lower doses and work up slowly. Methylene blue, actually, believe it or not, can increase a serotonin toxicity with hydrocodone. We need to be careful with that. Methylene blue also, just as a precaution, can stain tissue, skin, clothing, or whatever else it comes in contact with. If you're taking methylene blue orally, it gets passed to your system. We'll talk about some of the side effects. If you have a low flow toilet, I've actually heard reports of it actually can stain your toilet. So we need to keep that in mind. Also, too, some of the oral solutions, we may do it. It can actually stain the teeth. It's important to have good oral hygiene, brushing and flossing regularly, and that can prevent that. One of the other conditions, it's not real common condition, but there are 400 million people across the world that have the G6PD. It's a certain enzyme where the body can't break down certain things. For these patients, methylene blue is not a good choice. I know like 23andMe and other genetic testing can find this. So just keep that in mind. It's mostly a male-related condition, but this is something we really probably don't want to use methylene blue in these patients either. So let's talk about side effects. Yeah, keep in mind, it does turn the urine blue or green. That's one of the ways you kind of know that it's working. If you take a dose over time, your urine may go to a blue, to a green. The green may occur because your urine is yellow. Blue and green makes yellow. So just keep that in mind. It can cause some mild headache. It can lead to some dizziness, some GI upset. It can cause excessive sweating. It can cause some mild burning in extremities. But most of that is seen if we do higher doses. It's not seen at lower doses. There are also the risk of allergic reactions. Once again, we don't see as many of those at the lower doses, but we do need to talk about